Welcome to another week. Today we have Proposition 23, which is a kidney dialysis regulation proposition.
This is all about dialysis clinics. So in 2018, Prop 8 would have required dialysis clinics to issue refunds to patients or patients' insurers for profits above a certain amount, and that was like 115% of the costs of the care that they were receiving. So Prop 8 and this current initiative were designed to enact policies that related to dialysis clinics. So it's an attempt to keep dialysis clinics and owners responsible for their employees and patients. Let's see. Dialysis clinics. Okay, well, there are a lot of dialysis clinics are really important for a certain subset of they tend to be older individuals who they're in need of chronic care, which means it's ongoing. They need to go to these dialysis clinics in order to, because I think, for people who don't have kidneys anymore, or I believe it's somebody who lacks the kidneys for whatever reason, like they were a heavy drinker and they had to have their kidneys removed or something. And the kidneys filters your blood, right, of toxins. So if your body can't do it, then what you do is you go to a dialysis clinic, and you need to go there at least I think it's once a week. So it's a pretty important service for a certain subset of people. So anyways, dialysis clinics are all privately operated pretty much. I'm not sure if there are any publicly operated ones. So, this proposition is all about regulating them. And it would impose a minimum of one licensed physician to be present at a clinic while patients are being treated. And then there would be an exception if there's a shortage of physicians. So if all the physicians are busy with COVID-19, then it would be okay for a dialysis clinic to be we can't find anybody, so we're just going to give them the care anyway. So that there is a provision for that. So it also forces dialysis clinics to report data on dialysis-related infections and all of that stuff to both the state and the National Healthcare Safety Network. It would require the principal officer of the clinic to certify under penalty of perjury. Yeah, so just making sure that everything's all kosher, and then provide a written notice to the state health department to obtain consent from the state health department. So that you can't just a dialysis clinics, if this proposition were to be passed, dialysis clinics in the state of California would not be allowed to just close. If it becomes unprofitable for a business to operate a dialysis clinic, they would not be allowed to just close up shop, because there are people who depend upon their service, even if they're operating at a loss. They would have to go through the state and be like, hey, is it okay for us to close our clinic because we're losing money on this clinic or something happened? And then the state would have to assess the situation and say hey, dog, you've got too many people who need your service, so you're going to have to stay open. Or, hey, dog, it's all good. There are other clinics in the area. You can close your clinic. So I think that's the long and short of it. Cannot discriminate with respect to offering or providing care, and it cannot refuse to offer or provide care on the basis of who is responsible for paying for a patient's treatment. And that's important because Medicare and Medicaid is sometimes refused by dialysis clinics for whatever reason, because they don't pay enough or whatever. This proposition would make it so that dialysis clinics cannot refuse payment for Medicare or Medicaid. Increased state and local government costs would likely be in the low tens of millions of dollars annually. Yep. Voting yes. So if you vote yes, then that means that you want to have an on-site physician while patients are being treated. You want their dialysis clinics to report their infections to the state and federal government, and you don't want dialysis clinics to be able to discriminate against patients based on the source of their payment care. If you oppose this, then you think that it's all good. Dialysis clinics are operating perfectly fine right now. It's all good. Dialysis clinics should be able to do whatever it is that they're doing now. The system is currently working just fine. So arguments in favor. Should I just state the argument and then we can discuss the argument? Is that good?
That sounds good.
Okay. During the process of dialysis, patients are more prone to infections. Currently, there are no actual physicians or nurse practitioners required on site. If anything negative happens, patients should have someone with actual medical knowledge there to help them. Yeah, right now, I think a dialysis clinic can get away with just hiring like dialysis technicians, and they're not necessarily medically trained. They haven't necessarily gone to medical school. They've just been trained on how to operate the machines, and then that's it. So this thing, in favor, it would be like, hey dog, we want people who know what they're doing to be there just in case something happens. So I'll open up for discussion.
It sounds like this industry is very shady right now and very unregulated. So I'm leaning towards a yes on this proposition, just because I think having a certified physician on site is like, I feel like that's common sense. It's like, what if someone has a unknown reaction or like allergic reaction to the treatment, and you don't have anyone certified to treat that person, so that person just like
just call the ambulance and go to an ER.
Yeah, I agree with you, Carmen, because a while back, or maybe not a while back, even now, like, I don't know if you saw like on your social media, but there was this young woman who went in to do plastic surgery, and then the anesthesia technician effed up on her dosage or something like that, and then she became brain dead.
For like 5 hours.
Oh no.
Yeah, but this is the plastic surgeon office, so there is a certified doctor there, but it still happened.
Dead?
He did.
Like he's dead as in he's dead meat, or he died?
Oh, the young lady passed away.
Oh.
Oh wow.
So that's not good.
Yeah, but that's a different case, right? Because there was a plastic surgeon in the office, but the technician didn't administer something correctly. But I think we can apply it similarly to a dialysis clinic, where a similar situation could happen, where there was a bad reaction or something medically different than what they normally do, where they don't know what to do. But yeah, I know there's arguments on the other side too that are very valid. So anyone else wants to rebuttal me?
Yeah, this is just for the topic of patient safety. I mean, you'd be hard pressed to find anyone that will push back and say safety is not a concern. I mean, there might be people that do that, and you know, anything that gets in the way of the kidney dialysis company's profits is bad. But I don't think anyone here that has that opinion. Anyone else want to say anything about specifically patient safety?
Well, I guess this is just a thought, but where would we get the doctors? Aren't we already on like kind of a shortage?
There's like sorry.
From what I looked up before like coming here, is that if there's no doctor available, they can they can apply for like a 1-year grace period where nurse practitioner and doctor assistants or something to be on site instead of an actual doctor. Yeah.
My dad is actually on a dialysis. He got it because he had cancer, and then I guess the drug he was taking has a side effect of harming your kidneys, and it's really taxing. He has to go into the clinic 3 times a week, and he tells me that it's very, very exhausting. Like afterward, he has zero energy because you're sitting there literally 5 hours to exchange all your blood. Because if you want to do a more mild version, you're supposed to do it every single day at home, 8 hours while you're sleeping. And yes, so when he comes back home, he sometimes like has infection or he's swelling up. And then I actually went to one of his meetings, and there were like 2 nurses talking to me, but I never saw like a doctor on site. And I don't know whether they had a like translator for my dad, because I can't always go because he has to be there at like 5 a.m. in the morning and leave at like 10. So there's like there's no doctor. The two nurses talk to me, and most of the time it's kind of like, hey, you have to monitor what your dad's doing. And I'm like, well, why can't you guys do something about it? Because what happened is there's a lot of restriction when you're on a dialysis. One, you cannot have more than like ballpark 2 liter water per week.
What?
You cannot intake a lot of sodium because you'll swell up. And what happens is when they change your blood, you have too much water weight that's still in your body. So they have to account for that too. And for a while they didn't, and my dad ended up in the ER having to do like 2-3 dialysis in like one day. And like there's a lot of things they can't eat, so having a doctor there would be very sufficient, telling them like, hey, what you are and you're not supposed to do. The nurse tells me, but I feel like they're just pushing the responsibility onto me. And my dad had all these other like side symptoms that they're just, what they tell me, just like, why don't you talk to your doctor or go to the ER? They're like, it has nothing related to the dialysis. And I made my mom take observation notes like, hey, let me know what days these symptoms show up and how many times per day. And she said that it's every single time is when my dad comes home on that day of that he has all these symptoms.
Oh,
And I
wow.
try to tell the nurse, and they're like, well, it can't be related to dialysis. They're both nurse practitioners. So, I mean, they're just like, it can't be. It must be something else. And I'm just like, well, that's not good enough answer, So, yes. So definitely I'm voting yes for this proposition.
Mm.
Yeah, thank you for sharing that. I mean, before I knew about dialysis clinics, I always assumed that if you needed dialysis, you would just go to like the hospital, like that's where it would be performed. But I guess that's not the case. It's like there's this whole other industry catering to that one specific thing because it's very necessary.
Yeah, like my dad's part of Kaiser. So it was like and the clinic that he goes to is where Japantown is. You guys know where Safeway is in Japantown? It's literally like right across from it. That's where
Who operates that clinic though? That specific dialysis clinic, like who operates that? Is it
the
also
Vita,
Kaiser?
I think. It's not Kaiser.
Vita?
They have to outsource it. Yeah, because Kaiser doesn't cover a lot of stuff. And then I'm guessing that dialysis is one of them.
Yeah, I think in some of these arguments, DaVita is called out specifically. I think they're a big one, and there's another one, Fresenius, and both of those companies, DaVita and Fresenius, are spending $111 million currently to defeat this proposition, and they also spent a lot of money to defeat Proposition 8, which was put on the ballot 2 years ago and would have, regulated this industry.
Which was defeated, by the way.
Yeah, it was defeated. It was like defeated like 60-40. But I feel like more people are better informed about dialysis clinics. So fingers crossed. But anyways, I don't know if anybody wants to add anything. I'll move on to the next argument.
Yeah.
Something really super quick. I'm not sure how correct this is, but they said that a lot of patients that uses dialysis, they ended up in ER. So the whole argument is that it would save more money if you have a doctor on site versus like ending up later on they end up ER. Because my dad, he in like 3 months, he went to the ER like 4 times. That's related to his dialysis. Like it got so bad that it was like they were really worried that they had to do 3 dialysis in a day because his heart was so swelled up from the liquid, from consuming too much liquid, that they had to do many dialysis in order to like get him back to normal.
Oof. Yeah, that's rough. But the next argument, real quick, I don't know if anybody. The next argument basically says like. The next argument in favor is like one of the things about this new proposition is that it would require dialysis clinics to go through the state. They would have to get state approval if they wanted to close down their operations. And I feel like this doesn't necessarily impact people who are living in the city of San Francisco as much. It's this provision is more for people who live in like rural or sparsely populated parts of the country where there aren't all these like high-tech hospitals in the area, or there aren't as many services in general. There are a lot of places in this country even that don't have like internet access, basic internet access. So dialysis clinics, if they're not taking in enough money, then they, you know, they want to close down because they're losing money on certain clinics and they want to focus more on the clinics that are making them more money. But this provision would make it so that they have to get approval from the state before they can close down, so that they're not leaving out certain patients who live in sparsely populated areas. I'll stop sharing. I don't know if anybody wants to add anything to that, or put any rebuttals against that or anything like that, or
That one is pretty fascinating that they have to ask the state before they can close down. And we're going to see like a balancing act, of course, because the corporations, of course, they want to keep making profit. And if they see one of their centers out somewhere random that is not generating enough profit for them, of course, they want to balance and they want to, you know, drop that cost. I don't know. It's just fascinating to me how that whole relationship will work, because of course the state, I'm assuming in the legal text, they have consequences for if, you know, the corporations don't follow all those rules. And so this whole contention is quite interesting to me. You know, the corporations could call the bluff of the government and say, you know what, we're not making enough profit, we're going to go under, and then what happens, I don't know, the state will have to somehow take over those clinics or something. But anyways, that's just my 2 cents. Fascinating.
Sorry, quick question. Where do you guys find the where the corporation have to ask permission to get closed down? You got source?
What I can do is probably I could share my screen. I mean, we could try to find in the legal text. I'll try to find it first while you guys go on, and then I'll share it once I find it somewhere.
Continue.
Yeah, I mean, I could move on to the next argument in favor. There's just one more, and then we can move on to the opposing arguments.
Sounds good.
Okay, so the last argument in favor basically says that, you know, the way that it's set up now, clinics do have the ability to discriminate based on how they're being paid, and this proposition would make it so that they cannot discriminate based on how they're being paid. So it prohibits clinics from discriminating on the type of insurance they had, and protects patients in every clinic. So it doesn't matter if you're like wealthy and you have nice, fancy private insurance, or if you're poor and you only have Medicaid, or if you're old and you only have Medicare, then they're required to take your insurance no matter where it comes from. Yes, and that's it. Those are all the in favor arguments. I don't know if anybody wants to add anything, if anybody has any anecdotes. Otherwise, I'll move into the opposing arguments and then we can get to the general discussion.
Yeah, I'm not too familiar with stories of patient discrimination, but I'm sure it occurs.
Yeah, I would be curious about like how often that occurs, but I don't like how it is just allowed. Like, even if it hasn't necessarily happened already, it would be nice to have something on the books that would say that you cannot discriminate based on the source of the payment. But anyways, the arguments against. So this prop is not good because this prop is seeking to have clinics closed. The immense cost to keeping these clinics open and requiring additional staff members to be hired will result in many clinics being forced to shut down for financial reasons. That's argument number one. Argument number two against. Sorry, I don't know if you wanted to stop.
Oh no, go ahead. We'll
okay.
Roll it all up.
All right. So then doctors have better things to do, dog. Hiring doctors for facilities it's a selfish thing. It takes away doctors from the patients who actually need them, and they would be taken away from places of work such as emergency rooms and other stuff, and they would be placed into bureaucratic jobs, dialysis clinics, where they aren't really needed. The oversight that is lauded, that is put in place by this proposition, would be sort of like just creating more bureaucracy within each dialysis clinic. That's the argument against. These doctors are going to be put in administrative roles that are not necessarily helping the patients directly. And I believe I have seen TV advertisements that have made this argument that it forces doctors into non-care focused roles and just sort of administrative roles. So that's one argument against. Another argument against is that it adds unnecessary costs. Performing dialysis is simple enough that fully licensed physicians and nurse practitioners are not necessary. That's how simple it is. So we don't need them to help out. Patients are already being treated by their kidney physicians and trained dialysis nurses. That's the argument against. So yeah. Rebuttal to arguments in favor. This is another argument against, essentially. Patients are already very unsafe under trained dialysis nurses. If anything happens, they are there to make sure that they are taken care of. Actual doctors serve no purpose for being there, even if they are there when an infection is happening. They're kind of unnecessary because the trained nurses are good enough. Clinics would be forced to shut down. And then the few clinic, yeah, so the rebuttal would be like, all of these regulations will shut down clinics regardless of any effort to prevent that from happening. And then that'll be bad because of overcrowding and stuff. The quality of service will diminish because of the type of insurance. So yeah, there you go. Yeah, I don't know if I think we could get to the general discussion now.
All right, let's do it. So, I want to bring up the point about corporations closing down some clinics. I'm curious if we expect that to really happen, especially if they have to ask the state permission. Obviously, the state has an interest in not allowing that to happen. So I'm relatively confident that they will try to keep all those locations open. But it is true that it will increase operating costs for those corporations. Undoubtedly, licensed physicians are obviously more expensive to hire and whatnot. So, no one can see the future. I don't know if we're expecting to see a lot of places actually shut down. What do people think? I don't know. None of us are healthcare experts or what have you. So, any thoughts on that topic?
I don't know.
Yeah.
I support this proposition. I feel like it does enough to prevent the sort of blanket shutdown of dialysis machines that is being. I don't think that will come to pass. I think. Yeah.
It's also, okay, next topic. It's also interesting whether or not there will be a shortage of doctors. Again, we don't have the numbers about how many people, graduate school or what have you, certification programs, and whether or not where this is actually a huge concern. These are places for more research if we are super interested in obviously exploring the question further. And I'm not aware of whether the state keeps track of how many licenses. I think they do, of course, because they issue the license, I think, in the state. But I don't think they keep track of how many are working for Kaiser, how many are working for the kidney dialysis people. So I don't know, is anyone really concerned about that point, or we just don't really have enough visibility to come to some type of position on that point?
Well, I'm concerned about doctor shortages in general. I just don't believe it's necessary. It's a good argument against this proposition because there is a provision that allows dialysis clinic to operate without a physician if there are none in the area. So I think that provision sort of solves that potential problem.
I think part of the doctor shortage problem is that they get burnt out within a couple years. Then what if they just kind of go on rotation where, oh yeah, they're in the care service for this many years, and then they rotate over to something more administrative where they kind of take a break and then go back into it. Not that I can tell the government what to do, but.
Or they specialize and make a ton of money.
Or do that.
Doing foot stuff. Or something else.
Yeah, I don't know. It seems to me being posted at one of these dialysis, it's a relatively cushy job. Like you're not, no one's coming into your ER like, bleeding out or something like that. It's like really routine, and I would say maybe that's better. I don't know how the corporations would put their salaries to be competitive or what have you. But honestly, yeah, if there is a shortage, I'm sure obviously the state will exempt a lot of the dialysis places from having it, because you can't just magically come up with licensed physicians, right? The state will, if they have to, they will obviously triage, if you need medical personnel in emergency rooms and, places like that, there is a triage to be done. So I'm not too concerned about that argument against.
Can someone clarify for me what is the measure or the protection of the company not going bankrupt?
The protection?
Yeah.
So this would definitely incur a cost on the company. There is no like hard protection that says this law will, is not intended to bankrupt the company. And again, I don't know if anyone has any figures about the profits that these companies are making or what have you. But what I do see somewhere is that 75% of the market is served by two large corporations. So, and this is obviously a very necessary service. So there is always a market. So in that sense, like if you're serving most of the market, you have a source of revenue, right? I don't know if it's a concern that they're going to run out of money, right? I do want to bring up, this obviously brings up the question of whether this sort of service and all types of medical services, should be left up to, the private market, when it's such a necessary service, right? It's life or death. We have to deal with whether or not this corporation feels like putting it down in this community is profitable or what have you. Bothers me. I don't know if it bothers other people that we're having that type of conversation.
We could look at DaVita's financial statement. This is the report on their website, 2019.
Okay.
And then
Control F revenues or something.
one of their, it's like in 2019, operating income was $1.643 billion and adjusted operating income was $1.768 billion.
Well, that's
Cash
the
flow was $2 billion. I don't know. These seems like really big numbers.
Income
well,
and
that's-
revenue are
that's-
different things, though.
yeah, that's just income. What was their profit? Did they say?
Neither
I'm
net
pretty sure they have to
profit-
disclose their profits.
Revenue.
Control F. Let's look.
There's 233 revenue stuff.
Yeah, they're publicly listed too. So I mean, that kind of puts things in a little bit more perspective, right? You have to-
Yeah, they're publicly listed. So if they do need a cash infusion for whatever reason, like for the transition or whatever, from pre-proposition to post-proposition, they would be able to raise that money because they're publicly owned. They could just sell more shares. So, that allows them to get through bumpy spots or whatnot.
Oh, here.
Although their stock price will probably plummet.
Revenue.
Yeah.
Total
COVID.
consolidated revenue was 11,308. Well, I mean, this is in millions, so this would be $1 billion.
11 billion.
$1.1 billion.
1 billion.
Wait, no, that's 11.
11
That's
billion. Not 11 billion.
yeah, that's 11 billion. Sorry, not 1.1.
Yeah,
Is
we want to
net-
look at operating income because that's after all the expenses.
Is net
point-
income the same as profit or what?
Huh?
Anyone know? Net income?
Yeah, net income is like all the money in minus all the expenses out. So that's how much they actually earn.
Oh, so their apparent Wikipedia says 810 million in 2019 is their net income.
Yeah, so this is Q4 of last year. So this is just within 3 months, their
Mhm.
last 3 months of last year.
Yeah, I feel like it's a very profitable business. They have a lot of people who need their service. Like it's a necessary, like it's a very inelastic good if you want to get into the economics of it.
Yeah.
You can't just be like, I don't feel like doing dialysis today. That's kind of the same way as saying, I don't feel like living today. It's like, you're going to go in and do it, It's not like buying a candy bar.
Okay. I want to answer Jackie's question because I found in the law where it does say that they have to get consent to close. This is in the, you guys see this here? Section 5 of this thing will be added to the California Health and Safety Code to read, prior to closing a chronic dialysis clinic or substantially reducing or eliminating the level of services, the clinic or its governing entity must provide written notice to the department. I think it's, some part of the health department or whatever. Department shall have the discretion to consent to, give conditional consent to, or not consent to any proposed closure. In making its determination, the department may take into account information submitted by the clinic, its governing entity, any other interested party, including the effect on the availability and accessibility of healthcare, evidence of good faith efforts to sell, lease, or otherwise transfer ownership, and to continue operating the clinic. They will need access to the finances of the clinic and what have you. So there is, if it passes, that's what needs to be done, Jackie, regarding consent in the state.
Yeah, because one of the big argument against it is that, like, oh, if you do that, then they're going to close down the dialysis sites, and like then people can't get dialysis and stuff like that. So that kind of like counteracts. They can't just randomly close it down because they're not making money. Okay.
It actually, I wonder why we just don't have it like as a public service versus the
agree.
private industry.
Expensive, man.
Oh yeah, it's probably expensive to operate, but they're making so much money.
I agree. Yeah.
The state could set certain prices determined by like making like a modest profit, or maybe not making, or maybe they could just offer the service at cost, and then the state would not be making any revenue or not be making any profit. But whatever, it's like, I feel like that it'd be really hard to get that set up with the state.
Yeah, I think we're mostly on the same page. Does anyone think they're voting no or leaning towards the middle or anything like that on this question? Anybody want to, bring anything up before we move on to the next proposition? Does anybody want to volunteer to facilitate the next topic? Going once, going twice. All right, here we go.